Okay, good afternoon, everyone. I think we will get started. Thank you for joining us for this month's Teach Educational Round. Here with us today, we have Erin Steele, who will be presenting Tobacco Cessation Program Adaptations and Strategies during the COVID pandemic. But before I hand it off to a presenter, I'm just going to go over a few housekeeping slides as per usual. So if you're interested in obtaining a letter of completion for this month's Teach Educational Round, please make sure that you have registered for this webinar and completed the pre-learning assessment. You have signed in to view this webinar using your first and last name so we can track your participation. And finally, you complete the evaluation and post-learning assessment, which will be emailed to you this afternoon, and you have 1 week to complete that. Please note that a copy of today's presentation slides will be sent along with the recording this afternoon as well. This webinar is being live tweeted on Twitter, and you can follow us at PS Quit Smoking and use the hashtag #TeachWebinar to post or read questions. Here's a biography of our faculty presenter, Erin Steele, who is a registered practical nurse at Chickamek Community Health Center in Midland, Ontario. Erin has been nursing for 5 years, and in November 2019 obtained a health promotion nurse position at Chickamek CHC. In this position, she has been involved with the Quit Cafe program, providing nicotine replacement therapy funded by CAMH's STOP program. You can read more about Erin here. Here are a list of her disclosures, as well as our disclosures. Please note that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. These materials, as well as the verbal presentation and any discussions, represent only general principles, and they do not replace the need for clinical assessments or treatment plans by healthcare professionals. And you are welcome to use the chat feature during today's webinar to provide any feedback or post any questions. To use the chat feature, you can click on the speech bubble icon in the control panel, and please make sure that you select all participants to ensure that both the panelists and the host can read your questions. And with that, I will leave it to our presenter, Erin, to take it away. Thank you, everyone, and enjoy the webinar.
Hi, everyone. My name is Erin, and I'm a presenter today for this webinar. It's my first webinar I've ever done, so bear with me if I'm a little bit slow at some things. So the topic today is how we here at Chickamek have adapted to the COVID-19 pandemic with our smoking cessation program. And we title our program the Quit Cafe. So the learning objectives today will be, I'll describe the adaptations of smoking cessation programs during the COVID-19 pandemic. I'll discuss some unique challenges that we've encountered by various client populations during this pandemic, as well as discuss some potential solutions. And then third, I'll identify how our smoking cessation program may evolve once some COVID-19 restrictions have been lifted. All right, so to paint a bit of a picture, I'd like to talk more about how we were before COVID-19 because I think it really shows the contrast and how well we adapted. So our original Quit Cafe, it was sort of exactly how it sounded like. It was a group that would come together with registration, and we would have a conversation once a week. It was held on Thursdays for 1 hour, and we would serve coffee, tea, and snacks. Eventually, because our clientele can register for up to 34 weeks of nicotine replacement therapy, we got to know each other quite well. So before COVID and everything like that happened, we had some clients bringing in baked goods and homemade things to share. It was very much so like a friends and family sort of feeling in the group, so it was lovely. The group component itself was led by our addictions and community health worker, Jeff Graham. When he is not available to present the content and host the conversation, I would step in as needed. As I am a nurse, it was a good fit. There was lots of conversation that we could have from a nursing standpoint. And some of the topics that we would discuss weekly would vary from nutrition to managing boredom, triggers and tips. We would vary in topics as well as cycle through because every 6 months we would often have a new group of people as clients are allotted their 6 months of nicotine replacement. This group was really great because it allowed for a group support, very therapeutic with personal sharing and lots of support. It was set up in a large private room, so there was a lot of privacy protection involved. Because we are a community health center, we are very cautious of privacy and protocols that go along with working in a healthcare facility. So there was privacy blinds and tables and chairs set up in circle format to really promote that feeling of inclusivity. So it was very much so a therapeutic and healing environment. And there was always house rules laid out before the group started, which would address things such as keeping things private amongst the group. So if two clients were to potentially run into each other in public, there was sort of an agreement that their confidentiality would be held between the two. We would talk about respect, allowing others to speak, allowing others to have their own opinions without any judgment, as well as discussing appropriate language while in the group. So it was a very therapeutic way in order to have a social aspect and a healing aspect, as well as what I will get into next was the nicotine replacement side, the more medical side. So it was really great. So while my partner Jeff would be presenting, I was sort of in a neighboring room. So the flow would be very managed from group and then over to me at the end of the conversation. It wouldn't be atypical for the group to run, longer than the hour allotted time. So it would begin at 10 a.m. and it would often run till 11:15 or 11:30, depending on, how the conversation was flowing. So it was really nice that there was a bit of, fluid timeframes around it so that people could really have the opportunity to share and feel supported. Also in the group, there was an allotted amount of time for each client to share at the beginning and at the end of the group conversation on how they're doing, their progress, any hiccups they've run into. So it was also always available for a client to say pass if they didn't feel like sharing. So it was very well tailored to whether you wanted to share or kind of withhold. So we always were respectful of that. And so while the clients were in this group, I would take all of our clients' order forms that they would fill out on their way in, and I would package them in paper bags with a sticky note of their initials on the bag so that privacy, again, was sort of maintained. I would also be available to help with any clients that needed help with completion of forms and registration, because the clientele that we serve here at Chigamec can sometimes be lower socioeconomic, low income, and things like that. So we did have some literacy difficulties, some inability to read and write. So I was always available to help, which was lovely. To have a partnership with a nurse is great. So yes, I would fill the orders while the group is going on, and then I would also allow for anybody to adjust their order after the group program in case something that came up in conversation changed their mind on a dose or a product that they wanted to use. Perhaps in the group, products were being discussed and they had originally asked for gum, but now they think maybe the inhaler would be better tailored to them. So we were always very flexible with changing orders. So I think one of the reasons that we were so successful was that we had so much flexibility. It was always very well received from our clients. So once they had their group, they had their coffee, their snack in the group, I would prepare all their nicotine products, and then it would be a quick pickup on the way out, or they can stay and talk, ask any questions to myself, and it was really well done. So how we adapted during this pandemic, it was actually quite successful right from the beginning. Not only are we experiencing a pandemic, but the organization that I work for had a movement of sites during the pandemic. So we moved in April, and that was sort of at the height of all the COVID, very high alert kind of topics. So we would set up a table outside of our old building, which didn't have as much space outside as our current one. So at the beginning, We just set up a table. The downfall to that was that it was still the winter months. So it was sort of clients would wait in their car until they saw that the table was ready to be approached. Myself and Jeff, we would be masked and had sanitizing spray and wipes nearby in case the client touched the table or something like that. So we made it work for a couple of weeks at our old site, but then when we came to our new site, things just improved so much more because we had a space in front of our brand new built building that had a covered canopy, so we were able to be protected from the elements and the rain, the sun, no matter what the weather is, we can still serve our clients outside. So how the curbside and our key pickup went is that we had an arrangement with a table, some chairs, my cart, which was full of patches, lozenges, and spray. So I would have all the products that I needed, as well as paper bags, registration forms, and short order forms. So I would bring all my resources outside with me, and we would distribute anywhere from a 2 to 3 week supply to our clients. And our goal behind that was in order to reduce the amount of time that they have to come out into the community, especially to a healthcare setting, if that was something that was bothersome to them. So we always provided the opportunity to take 2 or 3 weeks. Whereas before, when we were doing our group program, it would be expected that the client come weekly or bi-weekly if special circumstances were in order. So we would, we would have the client approach our table. We would take their order off ourselves in order to eliminate the passing of pens and touching paper. We would just verbally exchange. I would package up their products, whether it's 1 week, 2 weeks, 3 weeks, whatever their comfort level was, and then they could have a little short conversation with us, and they could move along. If there was no line, we have adequate space for social distancing. So if there is no line, it allows the client to really, sit down and not sit down, but stay with us and talk with us for a short while if there's something that they really need to get off their chest. So it was excellent and remains to be excellent for the social aspect, because part of the group program was just such a heavy emphasis on tending to that social need that our clients have. And the other way that we have altered our process for the COVID-19 pandemic is that we do all of our new intakes either on the phone or via email, where I can send it to them and they send it back completed, or the social distance, because we do understand that a lot of our clientele are either older or perhaps not accessible to the internet. So they could just come to our table when we still have it on Thursday morning. I could send them paperwork and a pen that they can keep for themselves. And we have benches provided so they could go and sit, or they could complete the paperwork in their car as well, and then return the paperwork to myself. So everything has been very managed at a distance or with a bit of a virtual component, and seeing as 2 to 3 weeks of products can be dispensed at a time. We notice that every week we have fewer people coming every week because they're sort of on an alternating schedule. So we're seeing smaller groups of people every week, and it really allows for the social time if that's something that they choose, or they can just pick up their bag after they place their order and be on their way. Another adaptation that we have made during this pandemic is that we have done some home deliveries for some special circumstances. A couple of the issues that we have here in Midland is we do have a very high homeless population. So they are currently being put up in motels, and that is something that allows us to access them in a controlled manner, as opposed to being on the streets or in a shelter. I'm just noticing here that we're having some sound. I'm going to mute and I'm going to turn my
Hi, Erin. It looks like you're muted right now. If you just want to try unmuting yourself.
I just wonder if this is any better for people hearing the headphones in. Yeah, this is when you take the headphones in.
I think probably it was a little bit better before. If you maybe if you just move a little bit closer to your computer, it might help.
Sure.
Help, yeah.
Okay. Sorry, everybody. Can everyone hear me now? I'll just speak a little bit closer.
That's perfect.
Okay, thank you. Sorry about that. So yes, as I was saying, we do have a large population of our homeless people being put up in motels right now. So that allowed us a safe and large space for myself as well as another coworker to go to the motel, complete all the paperwork, and hand over an RT as needed at a distance with full PPE. So it was always very safe, very well controlled. And this also allowed for our clients with mobility or transportation issues to be reached as well. So along with the visiting motels in this area for the homeless population, we also have quite a few surrounding communities that are inaccessible by car, but a lot of clients that live in the area. So we did have a few clients that would run into mobility issues such as a fall and a hip fracture. We had some clients with broken down vehicles. So if that was the case, my partner and I, we would do a home delivery to these clients. The order forms was completed over the phone before we went to visit their home, and we would, the same process as before with the paper bag, and we would visit them at a distance, knock on the door, sort of either leave it on a chair or a table or the ground, and just make sure that they got it okay. We could converse at a distance. We were, again, wearing our PPE. So that has been a wonderful option that we have been able to provide. So that definitely eliminates a lot of the mobility as well as homeless, like the challenges that we have with those situations here. So I just included a couple photos here of visuals of how we've adapted during the COVID-19 pandemic. So in the left side photo, that's myself and Jeff with our table and our cart with the NRT products in the background. We have the cleaning solution and hand sanitizer with us at all times. And not pictured is the canopy that we are protected underneath. So if it rains, we can still hold our group, and if it's sunny, we're protected from the sun. And then in the right side photo, this was a client who agreed to have her picture taken and shared. So this is just an example of how we would verbally communicate, and I would take down the order form and then pass her paper bag with her products, and we could talk and have a therapeutic engagement. If she had any questions about NRT or her smoking journey, we had the option to do that. I do see in the comments the canopy is, they're asking how large is the canopy in, and people can sit and stay at a distance. We have, the canopy is as wide as our building. I couldn't really tell you the measurements, but we have at least 10 benches underneath of it. So if that gives any context to how large it is. So it's quite big, which is great because we can just be under one part of it. And if clients need to sit down and fill out paperwork, there's plenty of benches all spaced out appropriately so that they can do so. And I do see a question here, what is the plan for the winter? And I will address that in a few short slides away. Can you share what kind of order form it is? Yes, I can. So if you don't mind pausing for one moment. So I'll just give you a visual of what our order form looks like. So it's just a small piece of paper, and in the paper it asks if the client has smoked in the last 7 days, If yes, how often do you smoke, if daily or occasionally, as well as how often, as soon as you wake up, are you having your cigarette? So once those 3 questions are asked, I just ask verbally. Then we move on to their order that they would like to take home today, and they always have an option to take a long-acting NRT, which would be a patch, as well as a short-acting NRT, which would be gum, inhaler, or lozenge. So a lot of the times, because we are having people take 2 to 3 weeks worth at a time, some people will take 2 weeks worth of a one-step program, or sorry, a one-step patch, and 1 week of a 14 milligram patch in anticipation that they will slowly be able to move down in patch dosage over their 3 weeks of taking NRT. The only trouble that we have with that is that sometimes a client might find that they took perhaps a lower dosage patch than they anticipated, and they maybe got ahead of themselves. And if that's the case, then they can come back and we can top them up to the proper dose. So the most important thing is that we are extremely flexible with this program, and we are always willing to change, because we know that taking 2 to 3 weeks worth of NRT at a time can be sort of a guessing game. So we do our best to accommodate. So that is what our little order form looks like. Taking the order only takes about a minute, and then I have all my products just right behind me, as you can see in the photo. So it's a quick recording of the lot number, and then I pass it over the table in a paper bag. The other thing that we provide to all of our clients is weekly paperwork. Weekly paper information sheet that might address a topic that we would have discussed in the group. So that's nice to have a little bit of reading material if the client so wishes to take home. We also offer a variety of pamphlets, just smoking cessation information to keep them motivated during their 1, 2, or 3 weeks while they are not in touch with us, and keeps the motivation high. I was just asked to repeat the 3 questions that are on the form, so I can do that. The first question is, have you smoked a cigarette in the last 7 days? If you answered yes, do you smoke daily or occasionally? And then the third question is, how soon after you wake up do you have your first cigarette? So those are our 3 questions. All right. They can take, so in total, they can have 36 weeks of NRT products, and all of our products are monitored and counted for in our portal that we have on the Stop KMH website. So it's very controlled. It's very well organized to keeping track of where a client is at. And I also like to, once a month, I usually make a list of clients who are approaching the end of their allotted 36 weeks of products, and I give them a heads up in case they are needing to perhaps start tailoring down or just changing their smoking cessation journey in whatever way they feel is best. So some unique challenges that we've encountered with various client population and potential solutions. So I'm not sure if everybody in this webinar is familiar with where Midland is, but we are north of Barrie, and we are in very close proximity to our Christian Island reservation. So it is about a 20 to 25-minute drive to the ferry from Midland, and where we are here in Midland. So it is close. However, if mobility and transportation issues are at present, it certainly does not make it easy for our Indigenous clients living on reservation to access this program. And with Chigamik being a inclusive community healthcare center, our goal is to serve 1/3 Indigenous, 1/3 Francophone, and 1/3 Anglophone clientele. So we have a very strong emphasis on catering to our Indigenous and Francophone clients. Some of the issues that we run into with supporting the Indigenous clientele is that the ferry time to the island can often be very sparse, and especially in the COVID-19 pandemic, anybody who is not a resident of Christian Island is not permitted to board the ferry. So a way that we have worked around some of those issues with our Indigenous clients is that we have the ability to sync dispensing the NRT to our clients with any other existing appointments that they might have at Chigamik. So here at Chigamik, we offer a variety of programs that are Indigenous specific, such as massage therapy, traditional healing, foot care, diabetic information, anger management, as well as all of primary care. So we do have a fair amount of clients that are accessing our programs every day. And so a way that we have worked around servicing them during this pandemic is that I can sync up with them during their appointment here at Chigamik, whether it falls within our Thursday morning quick cafe time or not. So I'm very flexible in my schedule, and I'm able to meet with the client while they're here on campus, and I can have our little conversation, fill out our order form, and then pass them the products as they're leaving to minimize them having to come here more than once a week because, like I was saying, the ferry times are short and not everybody has access to a vehicle once they are on this side of the water. A lot of my order forms are completed over the phone, so I'm able to have completed paperwork with a client over the phone. And we also have 2 to 3 designated staff that visit this Christian Island reservation on a monthly basis. So they are all trained staff that can hand over the NRT on our behalf from the Quick Cafe. So that's always lovely that they have the option to, in a way, have it delivered to their home, which is great. Future plans to serve Christian Island directly are something that my partner and I are kind of cultivating right now. Our goal is to one day, perhaps when the pandemic restrictions are lifted with the ferry, to perhaps have a bi-weekly Indigenous specific quick cafe on Christian Island and eliminate the need for those populations to have to board a ferry and then drive 20 to 25 minutes to our site. So that is our future plan to serve our Indigenous population. And also, in the same sense, we also have a very high Francophone population in this area. The only issue with that is that a lot of these communities are, again, not right within Midland, and they are a bit of a drive away. So again, our goal is to serve 1/3, 1/3, and 1/3, and this can often translate to a lot of transportation issues to our French clientele, which often can be some older clients. So driving is not always an easy option for them to get to here at Chigamik. So some of the ways that we do cater to our Francophone clients is that we offer 100% of our services in French and English in every program here at Chigamik. We have a French NRT distributor available on site during program times. So I myself am not bilingual, and if I had a client who was interested in joining the Quick Cafe, then we have the option to bring in our translator and they can fill out the paperwork, and they are trained in NRT distribution, so they can become the provider for that French client during the registration program. Again, we can sync the NRT deliveries to clients if they have existing appointments here at Chigamik. We also have a variety of French-specific programs, so oftentimes our French clients who access our programs and are joining the Quick Cafe can be handed their products while they're here for whatever other program they are on site for. Another issue with a specific population that we've had during this COVID-19 pandemic is clients returning to work. So we noticed at the beginning of the pandemic, we had an influx of new attendees to our program. And we associated that with perhaps clients were laid off work due to the pandemic and maybe were at home and they realized that now is a good time to quit. They have the focus, they have the time to do so. Or perhaps they noticed an increase in their smoking with not being in their normal routine of going to work. So whatever their specific reason was, we did have an influx of new clients at the beginning of this pandemic. So for the first couple of months, it was wonderful because due to clients not having a specific work schedule to work around, they were able to come every Thursday when we offer our program if they so chose. But one issue that we're running into now, especially seeing that we're in phase 3, is that clients were returning to work in different phases. So what we did to accommodate that issue is if a client was on a really good roll with their smoking cessation journey and now they've been called back to work and they perhaps can't come pick up on Thursdays anymore, we were super flexible in the sense that we could have their friends or family pick up on the client's behalf. We would just ensure that we had permission from the client as well as had a conversation with the one who was picking up for them. And then there would be a phone call preceding the friend or family who had picked up for the client just to ensure that the client received their product. And again, we can also do home deliveries, as I previously mentioned, for clients who have to go back to work and still are looking to continue on their smoking cessation journey. Another client population that we have noticed some challenges in is our mental health population. So in combination with our Indigenous and French clientele, we also have a very heavy focus on mental health services here at Chigimik. So with that comes a lot of therapists and counselors that refer their clients to our smoking cessation program. So we do have a large volume of our clientele that access mental health services here at Chigimik and therefore join our Quick Cafe program as they have heard through that counselor or therapist. So we offer services such as counseling, DBT, CBT, anger management, depression, and anxiety support groups. So this population has sort of first access to the Quick Cafe. So due to the nature of why these clients are here at Chigimik accessing their mental health services, that in turn kind of comes along with having some perhaps very anxious individuals who are struggling with the pandemic in its own nature, as well as wanting to quit smoking. So two very stressful things and certainly not great in combination. So some solutions that we have found to having an increase in some very anxious patients is that we actually use the client's counselor to aid in the registration process. We find that oftentimes because they already have an established relationship with their counselor or therapist, it's a great starting point for them to start filling out their registration paperwork, which can be quite daunting. It's about a 15-page document that asks a lot of personal questions, not only about smoking, but also about mental and physical health as well. So we allow the counselors to fill out that paperwork with the client, especially if there's some anxiety issues that coincide with that client. The other solution that we have had to dealing with some very anxious clients is that because we have a table with a 6-foot distance as well as no grouping, the client has our one-to-one undivided attention for the entirety of our interaction. So it is no longer them perhaps feeling disappeared in a group setting, and they are able to have one-on-one interaction to feel perfectly supported, to ask any questions that they may feel in a private manner. So we find that that's really aiding with our mental health population and our clients with anxiety. We also provide a surgical or cloth mask for a client to wear when they approach our table. We also give them their own pen, and once the paperwork is done, everything is disinfected with wipes, and we have hand sanitizer between each client so they can really see that we're following all of the health guidelines in keeping the space very sanitized. I'm just reading a couple questions from the chat here. What language is the Quick Cafe conducted in when hosted in person? So the Quick Cafe is always hosted in English. We have a totally bilingual partner who, if needed, would be able to step in and conduct the program in French. However, I would say almost everybody who comes to Chigamik is able to speak English and chooses to speak that prior to French. But if for some reason we had a client who preferred to speak in French, we could absolutely cater to that. Any day that they came, we always have bilingual staff here. And yes, I can share the registration document to the group once the presentation is over, if you'd like. The next sort of challenge that we have is clients who are very insistent that they miss the group program. We have, like I was saying before, there was a very strong bond between the clients that came to our group program, and it became a very social experience for them. And they have expressed that they have a lost sense of togetherness, and with that, the interpersonal sharing and support and ideas amongst the group has fallen to the wayside. Also, there was a lot of motivation between clients. So like I was saying earlier, they had the chance to round in and round out and share their quitting or cessation or reduction journey. And so, you know, there was lots of rah-rah and clapping and lots of smiles and support. So it was a very encouraging group. And when that went away, with that goes a lot of, you know, the lost sense of that support. So the solution that we had to the group program, which has been extremely successful, is that every week or bi-weekly, depending on how often the client is coming, I do a phone call check-in. So this conversation can last anywhere from just 1 minute or up to 30 minutes, however much the client wants to share. I'm designated to dedicate my time to that phone call. So I use that time to offer support in lieu of what they would have had in the group. I give them the chance to answer questions after they've had a chance to use the product for a couple days, any questions that they might have on moving forward with dosages, as well as providing advice on what their next steps might be. So I've had a lot of varying responses to my phone calls. Some people aren't as communicative as others, so it's a short phone call saying yes, they're doing well, or no, they're not doing well, and how I can help. I've also had clients become very emotional. We've had lots of tears because at the end of the day, it's a very emotional journey, smoking cessation is, and especially in these times, there's a lot on people's minds. So it's very important that we give them the time to express anything that they have to express. And it's been very well received, the phone calls in lieu of the group. So that has been a wonderful solution that we have made. Another little challenge that we experience with our population is that, like I had mentioned before, most of our population is typically older and or have some low income needs, and they have expressed that there's limited access to internet, computers. So going virtual would almost be a deterrent if we had chosen to go that route. We know that some people, not everybody who attends the group is able to access online services, but I would say the vast majority of people who attend the Quick Cafe here in Midland at Chigamik are the typically older or low income or homeless, and having a strictly online platform to deliver the services versus the phone calls, it would be a disadvantage to those clients. The other issue that we have with that is that in our previous group, we would offer coffee and tea and snacks, as I mentioned, and when we do that in a virtual capacity, we no longer have the access to provide that food, and there is a fair amount of food insecurity in our area. So that was another issue that clients said that they missed. They often would rely on us for Thursday morning breakfast. So that's another reason that going virtual wouldn't really necessarily cater to all of the needs that our clients have expressed. So to solve that problem, we just continue with our weekly telephone-based phone calls, whether that be weekly or bi-weekly, depending on how much product they've taken. And again, that's within the client's comfort zone. However much they want to share, I'm all ears for that conversation. I'm just reading a question here in the chat. It says, are you running the cafe under the canopy, or is it just to pick up supplies? So the supplies are being dispensed under the canopy. So it's just a table with our products there. It's not a group, it's just one by one clients come to the table. We offer an hour for our clients to come, so they can come anytime between 10 and 11 on Thursday morning. So oftentimes we'll have anywhere from 4 to 12 clients in that hour. So if it's a day where we have less clients coming, it allows them the chance to talk to us for a bit longer. So just to clarify, it's not a group program being run under the canopy, it's just the NRT is being dispensed, and they have that opportunity to have a conversation with us at that time if they so choose. So I hope that clears that question. And then moving on, we have how we are hoping to evolve with lifted COVID-19 restrictions. So our vision is to resume our in-person programming for our fall quarter. So here at Chickamek, we release a new program guide every quarter. And for our fall quarter coming up, we have the potential to resume in-group programs with some heavy guidelines. So Chickamek, just to give some perspective, we are located in a building that is also in affiliation with a mental health hospital. So we, as a whole in this building, are considered hospital, and we follow hospital regulations. So in order for us to resume group programs, there is a fair amount of restrictions that will follow that. So some of the options that we have discussed is offering a rotating A and B week with registration. So that would be different in the sense as before, our Quick Cafe was 100% drop-in. You could come for 2 weeks and then not come for 8 weeks and then come back. As long as you were only dispensed your 36 weeks of NRT products, you could come to the program at your own discretion. However, when we choose to resume group programs, we're going to need to have a very controlled system on registering clients, perhaps separating them into A and B weeks to reduce exposure to each other as well as reduce exposure in the building. And there would be a large room provided with chairs at 6 feet or more distance between, as well as surgical masks provided to every client. And we are currently mandated to give every patient that enters our building a surgical mask. So we wouldn't run into the issue of a client being disadvantaged because they don't have a mask. So we always provide the masks. So that is one of our potential options for the fall. The other option that we have considered is offering the in-person group to be live streamed on the Zoom platform. So that would allow if we have any potential clients who'd like to partake in a group program but are not comfortable yet in resuming in-person programs, it would give them the opportunity to still feel like they're in the conversation. They'd still have the ability to interact on the Zoom platform. But again, that would be specific to our clients who had internet access and who had the ability to manage Zoom. So that's another option that we can have. Another option that we're looking at continuing regardless of how the next step unfolds is just to continue with our telephone check-ins every week for the clients, especially those who are elderly, immunocompromised, and perhaps anxious about group gatherings, as well as those who have a lack of transportation or mobility issues. We have found that the telephone check-ins have been vastly helpful in helping people stay on track throughout the week. One advantage to calling people throughout the week is that it gives them double the attention and double the support in their timeframes between NRT pickup, because they're getting to have the interaction with us as they're picking up their products. And then they also get to have the interaction on the phone at any given point throughout the next week. So what I'll do is if a client is unavailable to come to the phone, I leave a voicemail for them to call me back if they so choose, and then we can discuss at length on whatever issues they like to do. So it really has expanded how much therapeutic engagement we can have with the clients, and it has proven to be quite successful. Lastly, we are going to look at continuing our 2 to 3 weeks worth of products dispensed as needed. to continue to limit clients to having to come into the building and limit exposure. So that looks like something that we're going to continue. Our building has approved group programs, like I was saying before, with the 6-foot distance and groups under 10. So that is where our registration process will help, having 10 clients per week, rotating as needed. Whether we need to have an A, B, and C week, we would gauge that based on demand. And like you just said there, Susan, Zoom would also be a great way to allow people out of the area to be involved with the group. So yeah, those are our options. We are hoping that clients are going to be catered to regardless of which option they choose. If they prefer to continue to just pick up and then me call them throughout the week, or if they'd like to choose to come back to the group and conform to the policies that we have with masks and hand sanitation and social distancing. So we are going to leave that very flexible, as we always do with our clients, and what their preference would be moving forward. And that concludes my content for this webinar. So I'm open to any questions. I don't know if, Victoria, you want to take it over now?
Yeah, if anyone has any questions, please feel free to put them in the chat.
So the canopy is a fixed part of our structure. So it is just an awning. It's made out of the brick and steel that our building is made out of. So it's a fixed structure that is attached to our building. So it was just built with our new site here. Thank you. There is no cost to our program. It is 100% free. Yes, we do one-on-one phone calls. We don't do group calls, but we are looking at perhaps expanding to a group Zoom format if that is something that our clientele would be receptive to. Yes, it is 36 weeks of NRT products. And that does not have to be 36 consistent weeks. It can be anywhere within a year's time. So if they've done a few weeks of NRT and then they don't come for a while and then they come back, we allow flexibility, and the program is designed to be used that 36 weeks anywhere within a year. Going down here. The name was actually created by Jeff, who is the original facilitator for this group. So yes, I agree. It's a great name. We have been able to maintain our supply of NRT. We have not run out, only because I was updated back in the early stages of COVID that with shipping being delayed because of COVID, that you might want to adjust your inventory and stocking your products as needed. So I recognized the potential for slow delivery right away, and I did order and stockpile accordingly, and consistently I order about twice a month. Before COVID, I would order about once a month. So just with clients taking up to 2 or 3 weeks at a time, I feel like it's better to have more in stock. We maintain our expiration dates every month. We check every month. So we make sure that no products are going to waste, but that we always have lots. So before COVID, we were dispensing 1 week at a time. Only for certain occasions, special occasions, we would dispense 2. and we would never be able to dispense more than 3. So beforehand, it was quite rigid in how often we could dispense. The main purpose for that was to encourage clients to take advantage of coming to the group program and experiencing the benefits of having the group program. Our success rate here at Chigamik is a quitting rate of 33%, which is, from what I understand, quite high compared to traditional quit rates. So we understand that when we offer the group component plus the NRT distribution, it creates a really good harmony and sets people up for success. People can come back in the future after their 36 weeks is up. We just ask that 1 year from their registration has passed. So essentially, it kind of breaks down to 6 months in the program, 6 months off the program, and then they can come back to the program. And we've had people return to up to 5 or 6 times, and we are always welcome to see them back. And we just applaud whatever efforts they're making in order to reduce their smoking. I would say that the most common problem with our older adults is just the lack of understanding of how the products work, because they're perhaps not as accessible to, Googling things, or perhaps the writing in the box might be too small for them to read the instructions. So it's very heavily relied on that they listen to our instructions when we dispense the products to them, and then hoping that they can recall how to use. So for example, the gum, traditional gum, you can just pop in your mouth and chew to your heart's content. However, with the nicotine gum, there's very specific, chew and park it, and then, switch to the other cheek. So that is sometimes our hardest challenge with the older adults, is just there's a lot of information that they have to receive when they take the NRT products. Perhaps they don't remember, oh, did you say I could put it on my back? Did you say I could put it on my torso? So just a lot of small detail memory issues can be a problem, and especially if they can't, Google something or read the instructions. So another reason that these phone calls are great is that they can ask me those questions on the phone, and I can reiterate to them once or twice a week if they need that. If we go ahead with Zoom, we likely wouldn't make any changes to the structure of the meeting. We have actually implemented this half in-person, half Zoom concept with our staff meetings here at Chigamik, and it works out great. We just place the TV in the space where a person would be. And if we're rounding in, we round in until we get to the computer or the TV, and then we allow people on the TV to act as though they were here in the room, share their experiences. There's all sorts of features on Zoom with raising hands, chat boxes. So really the structure of the program would remain quite the same. How did we advertise to the community looking to increase numbers to the virtual program? So we advertised mostly on social media such as Facebook and Instagram, which we recognize does not necessarily attract the perhaps older population who do not use or have social media. Another way that we really get our word out here is that all of our primary healthcare providers, such as our doctors, nurses, and nurse practitioners, they all promote our program to any of their clients that are smokers and are perhaps looking to quit. So there's a lot of, word of mouth advertising to say. Was there a particular challenge of not getting enough people for the group? I would say no. We had actually an influx of clients joining Quit Cafe when the pandemic hit, and I'm not sure if that was the fear of being a smoker and living currently in a respiratory disease pandemic. So perhaps there was a bit of a fear-based motivation there, or whether it was simply the client maybe not working and had the time to come and dedicate their energy to quitting smoking. So we definitely saw an increase versus a decrease in our interest. So that was wonderful. I'm just going through here. Yes, just note, speaking to the flexibility of the program, we are a very flexible organization. Just the nature of who we tend to really encourages us to be flexible, and our clientele really appreciates that. We get a lot of positive feedback surrounding just how accommodating we can be to our clientele. So it's very well received. How did we advertise on Facebook and Instagram? We have a dedicated staff member who handles our social media. So she would just create a post. It would have just an image of perhaps Jeff and I at the Quick Cafe, or perhaps just, you know, an image from the internet of coffee and some cigarettes. And then it explained in the description how we have tailored our program to the pandemic. So it explains that it's a pickup process now. The phone calls will be delivered in lieu of group, and there was none to my knowledge of any restrictions around the smoking imagery or discussion. So perhaps that was because we just have an in-staff social media position. So perhaps that was our that eliminated that boundary there. Thank you, everyone. This is really great support. Just flipping through here. Yeah, I definitely agree, Sarah, that it would be interesting to talk to the new members about what motivated them to join. A couple people have openly shared that, you know, they were just at home and they noticed that their half pack turned into a whole pack, and then they were smoking a pack and a half. So I think just they were sort of forced to notice it themselves. So I think a lot of people mentioned that. So yeah. Yes, that is the correct address, Shauna.
So I think that's it for our time for questions. I'm just going to mute you, Erin, just because I hear an echo. Just sorry. So thank you, Erin, for such an informative webinar and for sharing your CHC's adaptations during COVID and for the plans moving forward. And thank you so much for everyone who attended. The chat was very engaging, and it looks like people found this session very informative. So thank you so much. And again, this webinar has been recorded, and I will be distributing a link to the recording this afternoon with the slides, so you can look forward to that, and also feel free to share it with your colleagues. A reminder that a link to the evaluation and post-learning assessment will be sent by email by the end of tomorrow, and you will have 1 week to complete that if you would like a letter of completion. And if you participated as a group, please email teach@kmh.ca with a list of the names who attended by 2 p.m. today. And our next webinar will be on motivational interviewing provided by Stephanie Cohen. And that will take place on September 23rd, and you can look forward to registration opening soon. If you missed a portion of today's webinar, or you're interested in viewing it again, or you would like to view our previous webinars, an archive list can be found on our website. Thank you, everyone, and enjoy the rest of your week.